A lot of questions if we offer pellets at Live Oak, and right now we do not. This is largely because pellets don't offer hardly any flexibility, and they do come with some risks. They can be good for the right person, and we have a few patients that come to us and they're doing well on them and want more, and we decline and let them continue where they're getting them from. But the big reason is that, one, it is a procedure. Any procedure carries a little bit of risk. They'll make an incision either on your flank, butt, or anywhere where you have enough fatty tissue to place the pellets. They put a trocar with some pellets, push the pellets in, and then you're good to go for 3 to 6 months. But anytime you do that, it's a bigger incision, chance for infection. You can get what's called a seroma, which is just a fluid collection around them where they're just not really absorbing much and it's kind of unsightly. You have to drain it. Sometimes the pellets can extrude. They'll just push themselves out. Your body works them out. Chance for infection, nerve irritation. Those are all low risk, but they are risks. With injections and creams, it's almost little to no risk. And the creams, injections are so adjustable, and we can be in control of them the entire time. If you put a pellet in and you're just not tolerating it because your levels are too high, you can't really go in and dig them out. And if your levels are too low, you have to do the procedure again. Another incision, insert the trocar, put in a pellet or two, and to get your levels up. People are needing hormone replacement and optimization at younger and younger ages. If this is going to be something that we're doing for the next 10, 20, 30 years, that's going to be a lot of scar tissue from the pellets built up. That can be cosmetically unpleasing. It can cause just difficulties in absorption. And so it can be different each time, even though if we put this amount of pellets in last time, you may not get the same results or levels with this time because we have now more scar tissue. And so from a business standpoint, it would be pretty awesome just to put some pellets in, say, see you later, see you in 4 to 6 months. But really, I like being in more control. I like to be able to adjust things along the way. And with injections, creams, we can make adjustments on the fly very easily. We know that they're going to absorb pretty well, where the levels are going to be, and we can change their dosing or frequency or route, within the same week. And even, estradiol, progesterone have oral options that are great. And so there's just other avenues we can take if you're not tolerating one route. Injections sound intimidating, but we have the majority of our patients on injections and they do very well. We can work with you on making it a more comfortable experience. If your spouse gives them to you and they're nervous or worried, bring them in. We'll teach them, and it gets easy. It gets to be where it's just part of your day. It takes you 15, 20 seconds and you're drawing it up and injecting it while you're having your conversation with your spouse. So they can get pretty easy, but long story short, pellets have a little bit more risk. They're harder to dial in and increase scar tissue in the long term. So we don't offer it.